If you're over 70, you've probably been told that staying on top of your health means more testing, more scans, more procedures. But what if I told you some of those tests, those same ones you were told were routine, could quietly be doing more harm than good? What if the very checkup meant to protect your future was actually increasing your risk of unnecessary surgery, cognitive decline, even cancer? Because here's the truth no one at your clinic will ever say out loud. After 70, not all tests help you live longer. Some might just make your final years more complicated, more medicalized, and far less enjoyable. In fact, recent studies show that up to 1 in 3 tests performed on seniors leads to complications, anxiety, or overtreatment that was never needed in the first place. And the worst part? Almost no one knows it. Most seniors walk in trusting their doctor and walk out with a procedure they never should have had. So today we're pulling back the curtain. These are 5 common checkups that many older adults are better off skipping. The risks are real, the side effects are lasting, and the number 1 test on this list is linked to thousands of cancer cases each year, yet still offered as preventive care. So stay with this video to the very end, because if you've ever had doubts about the testing treadmill, you're not alone. And what you'll hear today could change your health journey forever. Number 5. Bone density scan. It sounds harmless, right? But here's what most don't realize. After 70, nearly everyone shows signs of bone thinning. It's normal. But this scan often flags mild age-related bone loss as dangerous, triggering prescriptions like bisphosphonates, powerful bone drugs with disturbing side effects. We're talking jawbone decay, esophageal irritation, even increased risk of fractures due to bones becoming brittle in the wrong places. And here's the kicker. For most older adults, these meds don't significantly reduce fracture risk. One large study showed the actual benefit was less than 1%. Yet thousands take these drugs for years. But what actually works? Simple, proven strategies. Vitamin D, calcium-rich whole foods, and regular weight-bearing movements like resistance band workouts or walking. These strengthen bones naturally, without side effects. Number 4. Brain MRI for memory loss. It's understandable. You forget a few names, lose your keys, start to worry. Is it Alzheimer's? So your doctor orders a brain scan. But this is where things spiral. These MRIs often show white spots or mild shrinkage, which sounds scary, but are common with age. The problem? One study found that 86% of MRIs in older adults showed abnormalities, yet only 3% were actually tied to treatable conditions. Instead of scans, experts now recommend starting with a simple cognitive assessment. It's safer, cheaper, and provides a clearer picture of memory health, without causing panic or false diagnoses. Number 3. Cardiac stress test. If you felt a little more tired than usual, a doctor might order this test just to be safe. But stress tests after 70 are a slippery slope, especially if you don't have classic heart symptoms like chest pain or breathlessness on exertion. Why? Because they often produce false positives, showing problems where there are none. That leads to angiograms, stents, even bypass surgeries that offer zero survival benefit to asymptomatic seniors, but come with serious risks: bleeding, kidney damage, infections, prolonged recovery. What works better? A resting EKG or a coronary calcium scan? They give you a clearer picture of your heart risk without putting your life on a hospital table for no good reason. Number 2. Colonoscopy. Yes, it saves lives, but only when done at the right time. After 70, and especially after 75, and according to Medicare data, for every 2 lives saved, 20 people over 75 suffer complications. There are safer options. Non-invasive stool tests like the FIT test or Cologuard can detect most problems without the risks. And for people with a clean colonoscopy history and no symptoms, no need to repeat. Number 1. Full-body CT scans. These are often sold as premium peace-of-mind tests, but the truth is chilling. Each scan exposes you to radiation equivalent to 500 chest X-rays. That's right, just one scan. And new data shows that CT scan radiation now causes up to 5% of all cancers, on par with alcohol. These scans find incidentalomas, harmless nodules or cysts that would never have caused problems. But now that they're seen, you're sent for biopsies, surgeries, and tests that carry real danger. One 80-year-old patient we saw was in perfect health. His scan found a harmless lung nodule, but he ended up in the hospital with a collapsed lung after an unnecessary biopsy. The lesson? Scanning the entire body without symptoms doesn't prevent disease. It often creates it. So what should you do instead? Stay in tune with your body. Get checkups tailored to your needs, not your age. Ask your doctor, what will we do with the results? Will it change anything? What are the risks of this test? And if the answers are vague, it may be time to say no, because prevention isn't about doing more. It's about doing what matters, moving daily, eating whole foods, sleeping well, connecting with others. These choices guard your health far better than most machines ever could. So before you book that next test, pause, ask the right questions. Your time, energy, and peace of mind are worth protecting, and now it's your turn. Have you or someone you love been harmed by a test you later questioned? Drop your story in the comments. Let's shed light on what really protects us as we age. And if you found this helpful, give it a like and subscribe. We've got more eye-opening truths coming, because health after 70 should be empowering, not confusing.